When you've got a patient who is meets the inclusion criteria for being concerned about hyperkalemia because they went through a crush event, what are you looking for signs and symptoms, both with your physical exam and then with diagnostic testing, to make you concerned about somebody who might be going into hyperkalemia?
Rule note first, MOI, like his leg is flat. That's a big tip off. And then at least something that I would look for is abnormally, I guess, a bradycardia that makes zero sense. He's got a bunch of reasons to be tachycardic, but for some reason his heart rate is, 60 or 50, and it's not because of all the pain control that I've been giving him. That would be a great big tip off. That without some kind of EKG or, even just a personal like one lead type thing. That would be my first tip off, would be the bradycardia, relative bradycardia.
Yeah, good one. And oh man, I'm not going to tell you you're wrong. No, but I was hoping you were going to say something about the peak T waves, because I think that was in the social media post that got you on this diatribe. And what's really unfortunate is that is one of those wives' tales that has been talked about forever. But unfortunately, the reality when you work in the ICU day in and day out, and this has been published numerous times, is an absence of those peaked T waves does not mean you're in the safe zone.
Yes. Yeah.
And there's a lot of guys who will hang their head on that and say, "Oh, we're good, man. There's no peak T waves, no big deal." And the next minute, that dude can go into a non-perfusing rhythm.
Oh yeah, yeah. You cannot mention the word hyperkalemia without also mentioning peak T waves, or you will be removed. But
it's like a Pavlovian response.
I think I did read something about it. It happens maybe 25% of the time. But the point being, not necessarily how big or small the percentage is just understanding like it doesn't have to do that. You need to assess your patient. What will happen is that bradycardia, and they can be cruising along just fine, and then they go into VFib.